guys, Bill Demas, your disability attorney over here at Herman Wells. And I just want to talk real quick because I have friends who are doctors, nurses, medical professionals. I also get calls from medical professionals that say, I got a patient. My patient's trying to go out on disability or is on disability. I'm getting all these forms and I just don't know how to fill them out because I want to help them, but I want to do it in a way that I'm not hurting the process of my patient and disability. And I'm going to tell you, I love the doctors that reach out and the nurses that reach out because a lot of them don't. And a lot of times, unwittingly, medical professionals negatively impact their patients' disability claims, and it's because the insurance companies set them up to do that. Let me explain. There's a lot of insurance paperwork that comes on these disability claims, and you've all seen them. But that's on purpose. The insurance company wants to send this material. They want to aggravate you. They want to get you frustrated. They want doctors and nurses and medical staff to say, oh, geez, here comes this again. Oh, I already did that. I already did this. It's on purpose because they want you to get frustrated with the process so you stop helping your patient. The forms are meant to be confusing. Trust me. You got to read them carefully. And you got to make sure that you understand the forms. If a blank doesn't apply, you can write in does not apply. If they ask you a question and they only give you choices A, B, and C, but it's really E, you can write in the answer. They're asking your opinion. Give them your opinion. The best way to fill out these forms that the insurance company sends you is with your patient. You get a form. Call your patient, say, listen, you got to come back in. I can't fill these out without an appointment. You need to make the insurance company aware of that. Also, you got to be reasonable. You got to make time for your client and your patient to bring those in because they're on a deadline themselves with the insurance company. But why is it good to fill them out? Because you ask them questions. Okay, it's asking me here how long you can sit for. How long can you sit for? How long can you stand for? How long can you walk for? And you're getting that information from the client because I guarantee you, your client and patient has talked to you about it in passing, but they haven't given you details. So if you don't know it as a medical professional, you're using your depth of knowledge to answer these questions, but at the best you're guessing. Get them in the office, help them fill out the paperwork, have them help you fill out the paperwork also, and I guarantee you your patient will be happier and your opinions will be more in line with what your patient has been telling you and been telling the insurance company. Now, I get it. You're a medical professional. You spent a lot of time in school and you know this person. You've been treating Susie Smith for 20 years and you know that she's disabled. You know that she's unable to work. But if you just write disabled or unable to work and send it in, the insurance company and, oh, by the way, the federal judges, including Social Security judges, take that opinion and they throw it in the garbage. The reason is, guys, because you're a medical professional. They want a medical opinion out of you. Whether or not somebody can work, that's a vocational opinion that you're just not qualified to give. So what do? How do you answer that question? Well, you go back to what I was talking about. You call your client in. You talk about their ability to sit, stand, use their hands, concentrate, how many times they have to go to the bathroom, how many migraines they have a week. You talk about the medical aspect of it, and then you let people apply the vocational to that, because that's not your bailiwick. You wouldn't want a vocational expert looking at the file and trying to diagnose your patient. Don't do their job. And also, base your opinions and facts on objective findings that you refer to. A nerve conduction study, a positive straight leg test, any objective findings, or the consistency of complaints on examination. Certain things can't be objective, right? Your client tells you you're having 6 migraines a week. How do you know that? You can't test them for migraines. But if she's been telling you that consistently, and she's taking the medication, and she's using the medication, and she's presented a couple times with migraines, I think that's enough, but you have to note that. If your client's complaining of chronic fatigue, have them journal. Have them keep a record of it. That helps you. Here's another thing that will reduce your stress and help your patient's case. Do not talk to the insurance company's adjusters and do not talk to their doctors. They're going to tell you, and your patient's going to tell you that you have to talk to them. No, you don't. You can't ignore them because ignoring them will hurt your patient's case, but you want to be clear and you don't want to be interrupted during the day. And this is what these insurance companies do. They call you in 2 o'clock in the afternoon. Well, you're already 30 minutes behind on your patient. You can't do that. It's not fair for your other patients. It's not fair for your medical practice. It's not fair to you. So what do you have your staff say? Say, Dr. Smith is happy to fill out or Nurse Jones is happy to fill out the forms or answer any questions. Send them to us in writing. If they want to talk to you about something, please list your questions in writing. And you tell them that. You have your staff get their name and their phone number and their fax number. And then you have your staff send them a letter that say, Nurse Jones and Dr. Smith will be happy to answer any questions regarding Joe Blow. Please send your questions regarding Mr. Blow by fax. Here's our fax number. We'll be happy to answer. Why is that good? Well, first of all, because you can do it at your time. You can also do it with the patient's chart in front of you. You're running around, they hand you the phone and says, hey, it's Dr. Billingsworth from the insurance company, and he wants to ask you questions about Joe Blow. You may be a great doctor, and you may be a fantastic nurse, but you don't know every one of your patient's conditions off the top of your head. So you may be trying to help, but you may not have time to pull up the chart or review the chart thoroughly. You're just looking back at the last visit, and you may miss something. So get it in writing allows you to pull up the chart, allows you to spend the time to put forth that little bit of effort, and it's not going to be a lot, to make sure that you answer the questions. The other great thing about writing is that they can't take your words out of context. Because a lot of times I will show the doctor what the insurance company adjuster and or peer review expert, peer review doctor said. Dr. Jones said this, Nurse Smith said this, that the client could work. And they turn around and go, no, I didn't say that. I said that, she can't work. She may be able to work in 6 months with all this therapy, and all they're saying is she can say that she can work. So when you have it in writing, you can point back and say, no, I never said that, and your patient can do the same. Make sure that your medical records reflect what you're putting in the forms. A lot of doctors get their opinions just thrown out by these federal judges because you've been treating this person for 20 years. And all of a sudden you fill out a form, and what's in the form has never shown up in your medical records. Now, before you go, I understand. Before you say it, I understand. The purpose of a medical records is to remind you, the medical practitioner, of how the client was and the patient was the last time you saw them. It's not to support their disability. That's not the purpose of medical records. I get it. However, if your client is on disability and your patient has told you that they may be filing for disability, then you have to make sure what they tell you about their ability to sit, stand, lift, pull, carry, concentration, all those things are in your records. If they have non-objective type conditions, self-reported type of conditions, migraines, irritable bowel syndrome where they have 4 or 5 bowel movements a day, note that in the record. John Smith has 6 bowel movements a day and they last about 20 minutes and he's cramping 20 minutes afterwards. Put that in your medical records. Susie Jones has 5 migraines a week that lasts from an hour to 3 hours. Put it in your medical record. So then when you fill out the form and your client fills out their form, it goes from the medical records through the forms and even what your patient is saying, and it's the same message. You don't have a Social Security judge or a federal court judge or a peer review doctor saying the doctor's records are internally inconsistent. That's their favorite thing. It's internally inconsistent. They're putting all these restrictions and limitations, but the medical records don't even talk about that. Again, that's not the purpose of medical records. But when you're dealing with a disabled patient or someone that's going on disability, you have to go that extra step for them. Have patience. If your client comes to you and told you they've been denied disability insurance, a lot of doctors say, oh yeah, go ahead and appeal, I'll support you. Tell them to go hire somebody to help them. Don't have them appeal on their own. Most disability cases are lost when clients try to handle their own disability insurance appeals. It's a very complex process, and in a lot of these cases, that is the only evidence they get to put in front of a federal judge. They can't do their appeal, then hire me, and then I file a lawsuit and go and depose you and get your testimony. And no. If your opinions is not in the appeal, the federal court never sees it. So always remind your clients and your patients that are having problems to talk to an attorney that specializes in disability insurance law. They can call me, 727-821-3195 at Herman Wells. I'll be happy to talk to them. If you have a question, you can call me. I'll be happy to talk to you. My last thing is this. Your client and your patient is disabled. You need to have patience with them. The insurance companies make this process extremely hard and frustrating. They try to wear you down and they try to wear your clients down. So they just give up. If you have patience and you help your clients and patients through this time, it will help them have a successful process. Again, if you or anybody in your office has questions on how to deal with a client that is having difficulty with their disability insurance or all the forms that get sent to you and everything like that, please call me. I'll be happy to help. The other thing that you need to do that is important is whenever there's a form, you need to give a copy to the insurance company and give a copy to your patient and tell your patient to send them in. If you send medical records to the insurance company, give your patient the same copy and tell them to send them in. Because the biggest reason that these disability claims are denied is because the adjuster claims that they asked you for information and you never sent it to them. And you go, I faxed it. I got a fax confirmation. No, we never got it. We never got it. That frustrates your client. That frustrates you. So if you send it in and then give the same information to your client and patient and tell them to send it in and tell them to send it in certified mail, if they claim they never got it from you, your patient has a green card from the United States Postal Service saying that they dropped it off. And by the way, most plans say it's the patient's responsibility to obtain these medical records, and they can be penalized if you do not send them in or you do not respond. The courts have said that the insurance companies can deny your patient's claim because they did not get the medical records from you. So that way, not only are you helping your patient, but you're protecting yourself. If your patient gets mad at you, you can say, hey, Susie, I gave you copies and told you to send them in too. Or Susie, I gave you a copy. As soon as they said I never got them from Dr. Smith, you should have sent them in. And if an insurance company or a patient tells you, well, the insurance company says, I need to get them directly from the doctor, the plans never say that. They're lying. It's actually the client's responsibility to provide the medical records. And I haven't seen one disability plan yet that says that the medical evidence has to be submitted by the doctor directly. It just says you need to provide medical documentation. By you, it means the patient. Anyways, again, if any of you have questions on how to help your patients, because I know you all do, and I know it's frustrating getting letters from me and and insurance company, and it's eating your time, and you went into practicing medicine to help people, not to fill out paperwork. I get that. So that's why you get me involved. If you get me involved, meaning telling your clients to come work with me, I can make it go better. I can streamline. I can tell the insurance company not to bother you anymore, and that all correspondence goes through me. If your patient hires me, that's the way it will be. So the insurance company will never be reaching out to you guys again. It'll all come through me. Again, my name is Bill Demas. I'm the disability attorney here at Herman Wells. Be happy to talk to you or any of your patients. Give me a call, 727-821-3195.